Dr. Firnhaber here, and it's time for another 10 minutes of truth. I'm Dr. Paul Firnhaber here at Lincoln Disc and Nutrition here in Lincoln, Nebraska. And so I want to talk about an article today that involves a subject that I brought up before, and I brought it up in many of my Tuesday night talks, and that's the connection between elevated insulin levels and cancer and how to lower insulin. So growing research has really shown that there is a connection that higher blood insulin can result in cancer risk. And insulin is a growth factor, and high insulin levels trigger rapid cell growth in the body. And it seems like these studies show that higher insulin levels actually dysregulate the ability of DNA to control growth in cells. And these cells sort of grow much quicker and more out of control than they should. And that results in a much greater increase for cancer and metastasis. And so the other biochemical in the body that does this is estrogen. So a woman with too much estrogen has the potential for malignancies, because estrogen is a cell growth stimulator, so is insulin. The risk of developing the most common form of breast cancer by consuming a diet that's high in refined carbohydrates increases the risk of 36 to 41%. So if you're a woman and you eat a diet high in sugar, your chances of breast cancer go up by at least a third to 40%. Prostate cancer, for example, you get a 2.5-fold increase greater in men with the highest blood insulin levels. In fact, if you look at all the studies on prostate cancer and insulin, it shows that the range is 2.55 times to over 5 times the greater chances of getting prostate cancer with elevated insulin levels. And I've seen this in my practice. If you look at men with the highest third of insulin, so you have insulin can be 1/3, then the middle, and then the upper third of insulin levels. And men in the highest third have a 5.6-fold increase. In other words, your chances of getting prostate cancer are 5.6 times that of people in the lowest insulin levels. So as your insulin level goes up and you're a man, your chances of prostate cancer begin to go up exponentially. Let's look at colon cancer. A study found that insulin raises the risk of having precancerous growths by 17 to 42%, with higher risk associated with higher levels. The same thing in stomach cancer. Gastric cancer is increased by 69% for people with blood insulin levels in the middle third. But if you look at the highest third, that goes up to over 100%. Breast cancer, women with higher insulin levels are 2 to 3 times increased risk for breast cancer than those with lower insulin levels. With endometrial cancer and cancer of the lining of the uterus, I mean, it's ridiculous. 10-fold for early premalignant changes, and a shocking 45-fold for type 1 endometrial cancer. And these are for women in the higher insulin level stages. So if you look at a woman that eats a lot of sugar, that has high insulin levels, their chances of getting endometrial cancer, breast cancer, are way higher than those that eat a really healthy, low sugar diet. Liver cancer. Those with the highest insulin levels have a 2.4-fold increase in developing liver cancer. And brain cancer, the chances of getting brain cancer go way up with higher insulin levels. So what should an insulin level be? Well, the optimal insulin level, fasting insulin level on a blood test is 2 to 5. And I include insulin on all of my blood tests, all my comprehensive blood tests, because it's such an important marker for health. If you look at how do you lower insulin levels? Well, number one is you want to eat a low glycemic, plant-based Mediterranean diet where you're eating a lot of plant-based foods and very, very little sugar. Prioritize physical activity. Research has shown, and I've seen this, that exercise training can reduce fasting insulin and insulin resistance with and without type 2 diabetes. So exercise is a very, very powerful way to lower insulin. So if you're eating a low insulin diet or a low sugar diet and you're exercising regularly, it's a very powerful combination. Adding cinnamon to foods and beverages. Cinnamon has been shown to lower insulin levels. And even apple cider vinegar, adding apple cider vinegar to your daily diet, which I do that regularly. I take 2 tablespoons before I go to bed at night and chase it with water. Apple cider vinegar, it says, may help prevent insulin and blood sugar spikes after eating, particularly when consumed with high carbohydrate foods. Intermittent fasting is another way, so timed eating. So instead of eating breakfast, you skip breakfast and you eat lunch. And maybe you eat in that 8-hour window between 12 o'clock or a 6-hour window between 12 and 6 or 12 and 7. Increasing fiber, eating more fatty fish, reducing stress. Stress encourages the body to go into the fight or flight mode, which stimulates the product of stress hormones, which break down glycogen and turn it into glucose, which elevates insulin. Losing weight will help. And that also goes along with your diet and exercise. Now, what are some supplements that can help? Well, resveratrol is a supplement that can really help lower insulin. Omega-3 fatty acids, green tea is really good at lowering insulin. Ginseng, berberine. I saw a study the other day that showed that berberine may be as good as metformin when it comes to lowering blood sugar levels. So I use berberine a lot in gut issues. Vitamin D, magnesium, alpha-lipoic acid, chromium, and gymnema. Gymnema is an herb that has very powerful blood sugar lowering qualities, and I use gymnema a lot in my office with patients with elevated insulin and elevated blood sugar. So if you look at your health, you may want to get your insulin checked. Your physician can do it. We can do it here. We'd be glad to do it. And then we can tell you the steps you need to take to lower your insulin levels. I check my insulin levels at least twice a year. I need to do it again. I checked it about 6 months ago. It's in a very good range. So you need to do that. I would recommend you do that. I'd recommend you, whenever you have a blood test done, to get your insulin levels checked, because you want to find out, is your body in a state that can produce cancer easily, or is it in a state that can protect you from cancer? So that's really all I have for today. I hope this 10 Minutes of Truth is beneficial to you. If you would like to come into our office and get checked for some of these things we talked about, our number is 402-488-2220, and you can call and make an appointment. We'd be glad to take a look at you. Hope you have a great day, and we'll see you next week.